Chatbots have gotten incredibly good at answering our everyday questions, haven't they? I mean, they can write an email or give you a recipe in seconds. But when it comes to human health, a quick, reactive answer just isn't enough. Healthcare needs reasoning. It needs continuous monitoring, deep decision support, and actual, tangible action. Welcome to This Explainer. Today, we're unpacking exactly why the medical world is moving rapidly past simple chatbots towards something far more powerful. AI agents. Oh, and hey, if you love staying ahead of the tech curve, take a quick second to hit that subscribe button. You really won't want to miss where this is going.
So I want you to ask yourself a question. If you were facing a serious, complex medical concern, would you trust a simple text-based chatbot to manage your care? Probably not, right? You'd want a system that truly understands context, something that can securely pull your records, consult with your doctors, and actually follow up with you. And that creates a massive curiosity loop for the tech world right now. How on earth do we build artificial intelligence with stakes this high?
Okay, let's dive into this and look at the fundamental difference. A standard chatbot is essentially a very smart parrot. It answers and it reacts, but its context is severely limited to the prompt you just typed in. An AI agent, on the other hand, doesn't just react, it reasons. It has a goal, it knows how to use software tools to fetch new information, and it takes real action. It's basically the difference between asking a digital encyclopedia for a random fact and having a digital medical assistant actively working your specific case.
Part 1. The Complexity Reality.
To really understand why we need these active agents, we have to look at the environment they operate in. A hospital isn't just a building with doctors and beds, it's a massive, incredibly interconnected ecosystem. Think about the sheer volume of data flowing every single second. You've got doctors communicating with patients, radiology departments processing 3D imaging, lab systems updating blood work in real time, and electronic health records tracking the whole shebang. It is an overwhelming web of dynamic, constantly updating information.
So let's break down why this environment is uniquely difficult for AI. First, high stakes. We're not talking about making a typo in a marketing email. An error here is a potential threat to human life. Second, uncertainty, because biology rarely follows a textbook perfectly. Third is multimodal data, which we'll get into in a second. And fourth, longitudinal care, meaning a patient's health is a story that spans decades, not just a single snapshot in time. There is literally way too much risk here for a simple Q&A bot.
Now, what's really interesting about this concept of multimodal data is how it completely redefines what information even looks like. An AI can't just read text here. A single patient profile branches outward into dozens of totally different, complex data streams. An agent must be able to look at a visual MRI scan, read a numerable lab result, process handwritten doctor's notes, and analyze a cognitive biomarker, all at the exact same time, just to get the full picture.
Which brings us to a really critical realization. A patient is not one data point. This perfectly shatters the illusion that simple, linear chatbot logic can handle real human health. We are complex, evolving beings, and the technology designed to care for us has to actually reflect that reality.
Section 2, the core shift.
So if a chatbot can't handle this level of complexity, what can? Let's ground this in a practical scenario. Imagine a patient typing this exact question into a standard medical chatbot. Am I at risk for Alzheimer's? Well, a regular chatbot is going to instantly spit back a generic list of risk factors, age, genetics, lifestyle choices, and probably give you a web link to read.
Now, is that generic response helpful? Sure, in a general educational sense. But is it enough? Absolutely not. It doesn't give the patient the actual actionable answer they need about their own body, their own medical history, or their own unique biomarkers. Honestly, it leaves the patient exactly where they started, worried, and totally without a plan.
So the crucial point is how an AI agent handles that exact same question. It doesn't just react, it proactively reasons through it. It thinks, okay, to answer this, I need to use a tool to securely access this patient's medical history. It reviews prior cognitive tests, pulls up the latest MRI, and then actually takes action by alerting the primary care doctor that a deeper screening might be necessary. That is proactive, goal-driven collaboration, a real game changer.
Think of an AI agent as having these 4 central glowing nodes. Reasoning allows it to connect dots across different medical disciplines. Memory gives it the context of your longitudinal care, like it actually remembers your symptoms from 3 years ago. Tool usage means it can actively query hospital databases or lab portals. And action, that means it triggers a next step, actively supporting clinicians in their daily workflows instead of just waiting to be spoken to.
Section 3, agents in action. Let's look at how this plays out in the real world. Oh, and really quickly, as we go through these, drop a comment below and let me know which of these medical AI use cases actually excites or maybe surprises you the most.
Let's move to and see how this builds on our previous example of Alzheimer's early screening. In step 1, the agent ingests all that multimodal data we talked about, the MRI, the demographics, the biomarkers. In step 2, it reasons across years of longitudinal changes, noticing maybe a tiny cognitive decline that a human eye might have completely missed in isolation. And finally, in step 3, it outputs a highly personalized risk progression trend and sends a proactive clinical alert right to the doctor's dashboard.
Or consider this radiology workflow. A radiologist is looking at hundreds of complex images every single day. An AI agent steps in as a highly capable co-pilot. It analyzes a new brain MRI scan, but simultaneously reads through 5 years of the patient's written medical history and prior imaging reports. It then visually highlights abnormal regions for the doctor, allowing them to make a faster, way more informed diagnosis based on everything at once. And agents go far beyond just diagnosing illness. Look at operational intelligence. AI agents can instantly coordinate scheduling, speed up hospital triage, and untangle complex care coordination, which literally makes the whole hospital run faster and cleaner. Then there's remote monitoring. Imagine an elderly patient at home. An agent can continuously track their sleep, physical activity, and cognition through wearables, instantly sending alerts to their physician if it detects a dangerous anomaly.
Section 4. Risks and the future.
Now, as incredible as this technology is, high-stakes environments demand high-stakes scrutiny. These are the warning signs flashing brightly in the medical AI space. Privacy is paramount. Patient data must be impenetrable. Bias in training data can lead to deeply unequal care outcomes. Safety and regulation are massive hurdles we have to clear. But perhaps the most critical is hallucinations. Look, if a chatbot makes up a fake fact about a movie, it's funny. If a medical AI agent hallucinates a dosage or a diagnosis, that is incredibly dangerous.
This quote perfectly grounds our expectations. Powerful, but not perfect. We have to remember that AI is a tool. It's a spectacularly advanced tool, for sure, but it is not an infallible, omniscient solution. It requires serious oversight, careful implementation, and most importantly, human judgment. And that leads us to the absolute most important takeaway of this entire explainer. The future is absolutely not about replacing doctors with machines. The future is doctors plus AI agents. It's a powerful, synergistic collaboration between the unmatched empathy, intuition, and ethical judgment of human clinicians and the limitless processing speed and data recall of AI. Try to picture a futuristic hospital not as some cold place run by robots, but as a place where doctors are finally unburdened by administrative overload. A place where clinicians are actively assisted by their AI agent counterparts, giving them more time to actually sit down, look their patients in the eye, and provide compassionate care, knowing the agent has analyzed every single piece of data perfectly in the background. So, I'm going to leave you with this provocative thought. What will your next doctor's visit look like? Will your physician be staring at a screen typing notes, or will an AI agent be handling the data while your doctor focuses entirely on you? The shift from chatbots to AI agents is happening right now, and it is going to fundamentally revolutionize how we experience care. If you enjoyed unpacking this source material with me today, please hit that subscribe button, give this explainer a like, drop a comment with your thoughts, and share this with someone who loves the future of tech and medicine. Thanks for joining me, and keep questioning the future.